Hello, this is Doug McNay, President of the Silicon Valley Taxpayers Association. Thank you for taking the time to learn why you should vote no on Measure A and reject this and any other new tax on your November ballot. We are taxed enough already, especially when we are yet to recover from the Great Recession. This is no time to target already struggling homeowners with another addition to the already long list of taxes and assessments weighing down their property tax bills. We taxpayers have been more than generous when it comes to supporting the healthcare system of Santa Clara County. On November 4th, 2008, county voters approved the issuance of $840 million in general obligation bonds to improve earthquake safety of Santa Clara Valley Medical Center and replace closed medical facilities in downtown San Jose. $350 million of those bonds have been issued, and your share to repay the bonds first appeared on your property tax bill last year. I supported 2008 Measure A, and I proudly serve on the Bond Oversight Committee for that Measure A. That was a sound investment. Don't be misled by the unproven claims that this new Measure A tax increase would be a smart investment that would save taxpayer dollars. A search of Santa Clara County financial records has produced no documents to support these claims. Here are two things you're not being told about this year's Measure A. First, this new tax will change the way the Healthy Kids program is funded. Unlike Medi-Cal and Healthy Families programs that provide children's health insurance, insurance that you are already funding with your federal and state tax dollars, the Healthy Kids program is a locally funded insurance program. Since its inception in 2001, Healthy Kids has been funded by a combination of public and private funding sources, including an annual allocation from the County of Santa Clara and City of San Jose's Tobacco Settlement Fund, First Five, and a number of foundations. In addition, private individuals can and have made voluntary contributions to support the program. Families also pay a monthly premium whose amount is determined by their income level. Second, the only difference between the qualification requirements for Healthy Families and Healthy Kids is that Healthy Kids accepts members regardless of their immigration status. Once again, we are being asked by local politicians and well-paid bureaucrats to pay more taxes and learn to live on what is left. Healthy Kids program funding should remain as it is, a public-private partnership that must live within its means, just like the rest of us. If there was ever a time to reject any new tax, this is it. We are taxed enough already. Vote no on Measure A. Thank you.
Hello, my name is Kathleen King, and I'm the Executive Director of the Santa Clara Family Health Foundation and Mayor of Saratoga. I'm here today to ask you to vote yes on Measure A, the Santa Clara County Children's Health Protection Act. Measure A is very personal to me. During my son's second bone marrow transplant for a very rare syndrome, I received a letter on a Saturday from our insurance company stating that they only pay half the cost of a second bone marrow transplant. I quickly tried to figure out how to sell the house, divest all our investments, including our other children's college funds. It was very traumatic. Fortunately, on Monday, when I called the insurance company, they told me that this letter was for the hospital, not for me. I then understood what it felt like to not have the security of health coverage for my children. Similar situation this weekend. I was at a christening this weekend when parents were asked the simple question, what do you hope for your new child? All the parents answered, I want my child to grow up happy and healthy. Shouldn't we want this for all our children? 10 years ago, the Santa Clara County was struggling with a growing number of uninsured children. More than 71,000 kids in our county had no health insurance, and the vast majority of them were from hardworking two-parent households. In response to this crisis, community leaders came together to create the Children's Health Initiative, the nation's first health insurance program to cover all kids in our county. The Children's Health Initiative streamlined outreach and enrollment efforts for our existing public programs and created a new program, Healthy Kids, to cover all uninsured children that were not eligible for other programs. Healthy Kids was a huge success. When the program began, 1 out of every 8 children in our county did not have health insurance. In 2006, at the peak of the program, 97% of our children had health insurance coverage. Kids' health improved. Kids now have access to regular doctors and dentists. They get checkups, dental care, and immunizations, the preventive care they need. Children perform better in school and miss fewer school days. Healthy Kids brought in $30 million a year in state and federal resources for our county and local schools, money we didn't have before Healthy Kids started. As Dr. Chamberlain, assistant professor of pediatrics, Stanford School of Medicine, and a pediatrician at Lucile Packard Children's Hospital stated, the Healthy Kids program provides much needed assistance to at least 1/3 of the children she cares for, allowing her to see firsthand the program's impact on the lives of children in our community. However, without the passage of Measure A, these children would not be able to receive the care they deserve. Instead, their health problems will increase, school attendance will decline, and our emergency rooms will be used for primary care. We will be seriously undermining our community's future. Passing Measure A helps our children grow and thrive, and she cannot think of anything more important on the November ballot. One of our Healthy Kids, Diana Flores, was diagnosed with leukemia and was treated at Lucile Packard Children's Hospital. She is now a thriving 3rd grader. However, despite the overwhelming success of the program, funding for the Healthy Kids program has always been a challenge. Since the Healthy Kids started, it has survived on a combination of public and private funding sources that are now going away. Without new funding, Santa Clara County will be forced to disenroll thousands of children from the Healthy Kids program. Although national health reform expands health coverage to millions of adults, it won't cover all children. Therefore, we still need the Healthy Kids program. To prevent thousands of children from losing health insurance, local elected leaders put Measure A on the ballot so that we can maintain the successful Healthy Kids program and ensure all kids in our community have access to preventive health care they need. We have many diverse organizations endorsing Measure A: Cisco Systems, the League of Women Voters of Santa Clara County, Jewish Federation of Silicon Valley Leadership Group, and Silicon Valley Community Foundation. Measure A, a county parcel tax that equals less than $3 a month per household, will provide the needed funding to preserve the Healthy Kids program and ensure all children have a regular doctor for checkups and immunization. Measure A will also save taxpayers money by investing in preventive care. We avoid expensive trips to the emergency room that get paid for by taxpayers. Measure A is a 10-year program with oversight, and I hope on November 2nd you will get out and vote yes on Measure A. Thank you very much.